so I'm going to lay down the bed here. There you go. Okay, good. All right, so first I'm going to inspect your abdomen. Your abdomen is flat. Okay, and when was your last bowel movement?
Morning.
Morning? Okay, and when was the last time you urinated?
Morning.
Morning? Okay, great. Now we're going to auscultate your bowel sounds, beginning with the right lower quadrant, left lower quadrant, left upper quadrant, right upper quadrant. I hear bowel sounds in all quadrants. Okay, now we're going to pull up the bed a little bit. If you could sit up for me. Okay, patient is able to sit unaided without difficulty. Okay, now what we're going to do is test your motor strength. So if you could just hold your arms up like this for me and pull against me and push against me and grab my fingers. Okay, good. And if you could swing your feet over to the side of the bed there. Okay, thank you. Okay, and can you pull against my hands and push your feet up? Good. And push down. Okay, great. And now I'm going to check your pulses. So I'm going to check your radial pulses. They're equal and even bilaterally, 2+. And I'm going to take a look at your calves for any tibial edema or clubbing. And there is no swelling, edema, or clubbing present. Okay, and now we're going to check your posterior tibial pulses. They are even 2+ bilaterally, and your pedal pulses, which are also 2+ and even bilaterally. Okay, great. Are you able to get up and walk to the scale for me, please? Okay, patient is able to stand unaided and walk to the scale. Patient's motions are smooth and even with alternating arm leg movements. Okay, now we're going to weigh you. Okay, you're 107. And about how tall are you? 5'3". 5'3"? Okay, great. All right, let's continue this way. And patient is able to turn without effort and walk 20 feet back to the bed. Okay, so now we're going to check your pupils here. So if you could just look at the little pumpkin guy in the distance. Okay. Okay, good. Good. Okay, and then if you could follow my pen light as it approaches your nose. And then one more time. Okay, good. And if you could follow the pen light, I'm going to check your peripheral vision. Okay, good. And I want to note there are no oscillations of her eyes, no nystagmus in the 6 cardinal areas. Okay, and next what we're going to do is test your cranial nerves. So can you smile for me and frown and raise your eyebrows and puff out your cheeks? Okay, good. And shrug your shoulders. Okay, and can you push against my hand? Okay, good. And the other side? Okay, patient has equal strength, normal findings. Okay, now we're going to test your sensations here. So I want you to close your eyes and tell me whether you feel sharp or light touch and where, okay?
Sharp.
Okay.
Light.
Okay.
And hand. And
Okay.
foot soft.
Okay.
Left foot sharp.
Okay, great. Okay, patient is able to differentiate between light and painful sensory touch on all extremities bilaterally. Okay. All right, if you'd just like to lay back in bed for me here. Good. Okay, are you comfortable there? Okay, so we're gonna lower back the bed. Would you like the head up or?
That's perfect.
That's perfect? Okay, and then we're gonna lower the bed to its lowest setting, back to the ground. We're gonna be sure the brake is on. The call bell is here in case you need anything. I've kept my clean and dirty areas separate. I'm gonna perform hand hygiene one more time. And thank you very much for your cooperation. And the physician will be in shortly.